At the California Institute of Technology, Assistant Professor of Medical Engineering Gao Wei is in charge of research that could revolutionize COVID testing. His lab has created this carbon-based structure, which costs less than 5 cents but has the ability to detect compounds in tiny amounts. With blood or saliva samples, the sensor has been used on 19 patients to successfully detect whether they have signs of COVID-19.
Our technology can simultaneously monitor whether you are currently infected or whether you have ever infected or how severe you are infected.
Within 10 minutes, results can be sent to a smartphone. Gao hopes it will someday work as easy as a glucose meter, where anyone can perform the test and get quick results right at home. The sensor is currently being tested at hospitals in Los Angeles.
Even we have a vaccine, how long the vaccine will last and how effective the vaccine will be. Our technology can also monitor the immunity, can actually tell us whether we are still immune to the virus, whether we still have sufficient antibodies in our body.
While Gao's team focuses on testing across town at the University of Southern California, researchers are working on reducing the psychological stress caused by COVID-19.
Let's get this daily check-in started. How are you feeling right now?
The virtual human character Battle Buddy was created to help military families cope with depression. USC researchers are now adapting the technology to help people from all walks of life deal with the increasing levels of anxiety caused by the pandemic.
Individuals are more likely to disclose their symptoms of PTSD and depression when they're speaking with a virtual character than when they're talking to a doctor. So using a virtual character on a cell phone could be a way to provide some comfort to people who are in isolation, and also a way for us to detect early stages, early onset of depression or PTSD that may be a result of this COVID pandemic.
Mogzai says virtual humans can also help out overworked human hospital staff.
I see this as an advantage for hospitals that may need to be in touch with clients, do pre-screenings. It can take the burden off of their staff who has so much to deal with right now. And a strong advantage of our virtual characters is that unlike real humans, they don't get tired and you can use them 24/7.
Mogzai calls the virtual human work a multidisciplinary approach that draws on experts in clinical psychology and user interface design. It's a similar sentiment coming from Gao Wei's lab, which draws on chemistry, telemedicine, and experts from material science. In the end, it's all about collaboration driving innovation. Mark New, CGTN, Sunnyvale, California.